Good morning, friends. I'm Dr. Vivek here. Today I want to talk about hypertension with you all. Now, we all know that hypertension is a common problem in the world right now. Every now and then we see people saying that they have pressure. What do they mean when they say they have pressure? They usually mean they have high pressure, which is called hypertension. Because pressure is not a bad thing. High or low pressure is a bad thing. Firstly, we need to understand what is this pressure. So blood flows in the blood vessels. While flowing, it exerts pressure on the wall. This is what we call as blood pressure. When we water the gardens, the water that flows in the pipe is exerting pressure on the pipe. Similarly, the blood exerts pressure on the vessel and it flows. This is the blood pressure. Now, everyone wonders why they have blood pressure. Elevated blood pressure, hypertension. So 90% of the cases, that is, if 10 people have hypertension, among 10, 9 will have what we call essential hypertension or primary hypertension. That is, the cause is not yet known. The mechanism is not known yet. Whereas the 10% of the people, that is 1 out of 10 hypertensive people, will have hypertension secondary to some other problem, means due to some other problems, such as due to renal problems, most commonly, due to endocrine problems, etc. What do hypertensive people present with? It can be an incidental finding when people come for checkup. They find out that they have elevated pressure, or they can come with headache, vertigo, visual problems, renal problems, or complications of hypertension such as stroke, myocardial infarction. Now we need to manage hypertension. We need to keep this pressure in a normal range. So when do we say that the pressure is abnormally high? To be defined as hypertension, when the pressure is more than 140 over 90 millimeters of mercury. 140 being the systolic pressure, 90 being the diastolic pressure. Now we will see how we can manage. Now, there are two approaches which usually go hand in hand. Those are, one is the lifestyle modifications and the other is the pharmacologic approach, in which we use antihypertensive drugs. What are the lifestyle modifications? If you are a smoker, you need to stop smoking. Preferably, stop taking alcohol as well, or limit it to a minimal use. Maintain an active lifestyle. You should at least do 15 to 20 minutes of exercise every day. Eat green leafy vegetables and fruits every day. That is a good, healthy diet. Do not take extra added salt. Excess salt consumption should be inhibited. In the pharmacologic approach, we have drugs, frontline drugs such as ACE inhibitors, angiotensin receptor blockers, diuretics, calcium channel blockers, and in some cases, for example, if the patient has stable angina, we may use beta blockers as well. Preferably, we use monotherapy, one drug. If the pressure is not controlled with monotherapy, we go for dual therapy, and ultimately, further on, we may move on with polytherapies. Now let's see about those individual drugs. The commonly prescribed drugs are calcium channel blockers such as amlodipine, called Amlod, in the market. What does this do? What this does is it vasodilates. Like this is the diameter of your blood vessel. The pressure is more. It simply vasodilates it. So the pressure comes down. The peripheral resistance decreases and the pressure comes down. What ACEI-ARB do is angiotensin converting enzyme inhibitor, angiotensin receptor blocker. Ultimately, they result in decreased action of angiotensin II, which causes vasoconstriction. That is, these drugs usually result in vasodilation, increased diameter of blood vessel, as well as reduce the blood volume in the body. If you have reduced volume, this will decrease the blood pressure. Similar with diuretics, they increase the frequency and also urinary volume. So you have less blood volume in the body. If you have less volume, less water in the pipe, the pressure will ultimately come down. And beta blockers decrease the heart rate also. They cause vasodilation. Usually we go for cardioselective beta blocker. Regarding the complications, now if the pressure in the pipe is very much, the pipe to the brain can be affected. It can result in stroke. If the blood vessel, the blood supply to the heart is affected, it can result in MI, myocardial infarction, commonly known as heart attack. It can affect the blood supply to your kidneys, which can ultimately result in renal failure, beginning from hypertensive nephropathy. Hypertensive retinopathy can cause visual problems, and it can affect all the parts in your body because blood is needed in all the parts of the body. So that was it pretty much. Let's see how it has been.